Well, good afternoon. My friends, we've made a lot of progress in our fight against COVID-19. The curve is bending, but as Dr. Brown made crystal clear yesterday, we can't take anything for granted. Not when new, highly contagious strains of the virus have entered our country. If these new strains take hold, the consequences will be dire. The sacrifices each Ontarian is making, they've been for nothing. The time for decisive action is now. The past Boxing Day, we confirmed the first case of the UK variant of COVID-19 in Ontario. Since then, we've identified 51 more cases in the province. And we've seen how devastating the variant can be, how much more quickly it can spread. My heart goes out to the residents and families impacted by this terrible virus. My friends, I've sounded the alarm bell before. I stood at this podium and said it's not a matter of if these new variants will come to Ontario, but when. Through our voluntary airport testing pilot program, we've already identified 5 variant cases. These are 5 cases that could have otherwise gone unnoticed. 5 cases that could have infected others. I welcome the new measures announced by the federal government today. We've been calling for stronger measures at the border for months. And it's great to see that Prime Minister Trudeau listened to us. They'll be requiring mandatory testing for all incoming international travelers, putting in place stronger quarantine requirements and isolation measures, and suspending flights to sun destinations until April. However, it looks like these new measures won't be fully in place until a few weeks from now. That's a few weeks too long. That's why today our government is taking swift and decisive action. We're releasing a 6-point plan to stop the spread of COVID-19 variants. This plan will act as a first line of defense against new variants of this virus. As part of this plan, Ontario's Chief Medical Officer of Health will issue a Section 22 order to require mandatory testing for all incoming international travelers at Pearson Airport effective Monday at noon. And as soon as possible, we will have additional testing measures at land border crossings. I want to thank the GTAA for stepping up to support this new measure at Pearson Airport. They've been amazing partners, and thank you again. Mandatory testing will serve as a stopgap until the new federal measures are fully in place, because we can't take any chances. We need to screen every single person who's coming into the country and into Ontario for these new variants. For the sake of our long-term care homes, schools, and hospitals, for the sake of everyone. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier. As we know, the UK variant has been confirmed in our communities, with other variants circulating globally. As yesterday's modelling showed, the UK variant and other variants could put Ontario's pandemic response at risk. To control the spread of the virus and its variants, we are taking immediate action. Our 6-point plan will enhance the coordinated efforts the province is already undertaking to prevent the transmission of new variants. First, as the Premier mentioned, we will mandate on-arrival testing for international travelers until the federal program is in place. Mandatory testing at our borders is the most important thing we can do to stop the spread of these deadly variants in our communities. This will be done through the power of the Chief Medical Officer of Health by issuing a Section 22 order. Every traveller arriving at Toronto's Pearson will be tested, and if they refuse, they will be issued a ticket. Second, we are moving to quickly build the lab capacity to screen all positive COVID samples for variants within 2 to 3 days of initial processing. This will be in effect as early as next week. In addition, by mid-February, 10% of these samples will undergo full genomic sequencing to identify emerging variants. Third, given the evidence that new variants are more transmissible and may cause more severe illness, any lifting of public health and workplace safety measures must be considered very carefully until more information on variant spread is known and overall trends in public health indicators are lower. The fourth point of the plan will strengthen case and contact management efforts for all COVID-19 cases. The provincial workforce will continue to support public health units to ensure they can reach out to and monitor all cases and contacts as soon as possible. All asymptomatic contacts will be asked to repeat testing on or after day 10 of their quarantine. And the households of all contacts and symptomatic individuals will be asked to stay home and quarantine until the contact has a negative test. Fifth, we will continue to work to protect our most vulnerable, accelerating the vaccination of residents in long-term care, high-risk retirement homes, and First Nation elder care home residents, dependent, of course, on supply provided by the federal government. To further help protect our most vulnerable, Ontario is introducing a provincial antigen screening program for the expansion of rapid testing in high-priority settings such as long-term care homes, retirement homes, essential workplaces, schools, and congregate living settings. We will also be requesting enhanced infection prevention and control self-audits in the highest risk settings. And finally, Ontario will use integrated data and deep analytics to drive decision-making and inform planning related to pandemic response, working with external partners to incorporate the latest in research excellence. This will enhance the province's capacity to identify known and emergent variants of COVID-19. Through these measures, our government is taking immediate and decisive action to control the spread, protect our healthcare system, and save lives. I know that many of us have felt cautiously optimistic about the decline in COVID-19 cases in recent days. Most people across the province have been doing their part and staying home to help stop the spread of COVID-19. To everyone listening today, thank you. But this variant could have deadly consequences and may put our collective efforts at risk. So please, until vaccines are widely available, please continue to stay home and follow the public health measures we know work and keep us safe. Thank you.
We'll go over to the phone line for questions.
Reminder to press *1 if you do have a question. And your first question will be from Rob Ferguson at the Toronto Star.
Hi, Rob.
Hi, Premier. I'm just wondering what this will mean for the restrictions that we have in place now. You're very worried about the variants. Does this mean that you're thinking going past February 10th with the restrictions we have in place now?
Well, we're still a little ways off, and that will be up to the decision of Dr. Williams, the health table, and the cabinet. And we just want to make sure that no one lets their guard down. This variant moves extremely fast and can be deadly, and we're just very concerned. And you know what we're doing at the airport, Rob, is there's so many different tools that you use throughout this pandemic, and there's, as I always say, there's holes in the roof, and this is one hole that we can try to plug to the best of our ability. And I've always said about the airports, even on the voluntary basis that we had, at least we're having an idea, and we're catching some folks going through that inadvertently have or knew that they had COVID. And I think, and I want to, do you know who I want to give a shout out to, Rob? I want to give out a shout out to Minister LeBlanc, the federal minister, Dominic LeBlanc. The guy's a great guy. I met him, I think a couple of years ago, and we just hit it off. And now he really helped me move the ball down the field and cross the finish line. And I affectionately call him Dom. So Dom, if you're listening, thank you for all the help. And we're working collaboratively with the federal government until they get ready. It's going to take them a few weeks, but in the meantime, I think this is going to be a good program to try to catch as many people as we can coming into our province.
Follow-up?
Thanks for that, Premier. I just want to squeeze in another one here. It's kind of double-barreled.
Yep.
Just quickly, how much is the ticket that people will get if they refuse a test? And how long will it take you to get these tests into the land borders? What kind of tests will they be? I'm assuming they'll have to be some kind of rapid test, but you could clarify that, because there are essential workers going back and forth every day, and I know you would have to be cognizant of lineups and whatnot.
Absolutely, especially in Quebec, coming over to help out Ottawa General Hospital. So what I'm going to do, Rob, the ticket starts at $750 and can go up, but I'm going to pass it over to the Solicitor General and then over to the Minister of Health on the testing. I believe it's the PCR test still, but Solicitor General?
So thank you for the question. As the Premier said, the ticket, if you refuse to take a test when you come into the GTAA at Pearson, will be $750. Look, I don't anticipate the vast majority of travelers will refuse that test. I am hopeful that when they are guests in our country, in Ontario, that they understand we are only doing this to keep our citizens safe, and that they would voluntarily comply and take that test at the airport. Thank you.
Thank you. And with respect to testing, of course, what we're rolling forward with right now is the testing of travelers coming in from international destinations to Pearson. But we will also be looking at border crossings, land crossings, and so on. But we'll certainly take into consideration the fact that there are many healthcare workers from Quebec that come into Ontario every day to work. We will work on that situation so that they will still be able to travel back and forth, but we'll still have the necessary tests to make sure that they are safe and that we will be able to keep the residents of Ontario safe as well.
And I believe, Rob, just to follow up, I believe, and the Minister can confirm this, I think it's still the PCR test with a lower nasal swab going through the airport?
Yes, the ones that are being used by Switch Health at the airport are PCR tests, but they have a quick return rate within the next day with the test results.
Next question.
From Haley Cooper at Newstalk 1010. Please go ahead.
Thank you so much for taking our question.
Hi, Haley.
Premier, it seems strange that Florida and Arizona are not on the list of suspended flights to and from Canada. So in discussions, whether it be with the Prime Minister or Minister Freeland or someone else in the federal government, did the province ever ask for those destinations to be put on the list? And do you think what was announced today goes far enough, because we're still allowing international travel?
Yeah, really good question. I didn't mention Arizona or Florida, those specific states, but I encourage that every single person, at least in our case, that we're going to test everyone that's coming in. And I know I think the U.S. has been left off the list through the feds, but that's going to be up to them. You know, usually what happens is, you know, no one likes, you know, going into the federal jurisdiction, and I don't. We're trying to help them. We're working together, as much as provinces don't like the feds going into their jurisdiction. But in this case, we're working collaboratively together. We will have further conversations about people flying in from the U.S. But my main concern, our area, is going to be testing, and the other quarantine area, that's going to be the federal government. But we'll make sure that we test everyone that's coming in, because the positivity rate we saw at 2.5%, and as I mentioned before, even at 30,000. And then that was a low number, I think, with international travelers excluding the U.S. That's still 750 people coming in with you know, with COVID. That's massive, and that's just in 1 week. So I'm glad we were able to at least put one barrier up. It's never 100%, but it's better than nothing at all, and hopefully we'll be able to catch more people inadvertently. That they have it. I don't think anyone purposely wants to come in there and spread the virus, but I think it's a good barrier, that's for sure.
Follow-up?
Thank you. And my follow-up, there's been a lot of talk about increasing testing in schools, and we want to know what the government is thinking in terms of that testing. Would it be rapid tests?
Yes, it would be. It'd be the PanBio rapid tests, and we have plenty of those rapid tests, not only in the schools, with the long-term care and especially in the private sector where we see large employers. And I'll give you one example is Canada Post. Everyone's heard about the spread there. We encourage all large companies that have people working side by side to call the government. It's a reasonable cost. I believe it's about $6 each. And to keep your company safe and the people there working safe and your production line safe. But I believe there's 32 companies so far that have signed up, big, large companies in the meat, poultry, manufacturing, food manufacturing, automotive sector. So folks, if you're listening, you work at a big company, please contact us and we'll set you up with these rapid tests. And it just makes employers feel a lot safer as well.
Next question.
From Randy Rath at CHCH TV. Please go ahead.
Hi, Randy.
Hi, Premier. I'm wondering today, in the United States, Dr. Fauci is recommending double masking to try and keep the new variants at bay. Why aren't we doing that here?
Yeah, I'll pass that over to Dr. Williams.
So in the research and aspects around the variant, and that's what Dr. Fauci was addressing and speaking to, with the less inoculum needed for transmission, it's droplet spread. It's still the same measures are effective. The general message you've heard sometimes, a well-fitting mask is better than a couple of sloppy-fitting ones. And so you get a proper mask and wear it. We're asking our people in Public Health Ontario and with the Public Health Agency of Canada to review the guidelines and directions to say, is there any further recommendations we should be doing in regards to masking? Not only in the general public, which are saying if you do the masking, you wear it all the time, no face-to-face contact with people, remember your distancing and that, except with your household members. And so we're going to be asking for that review to take place. Right now, we haven't supported fully yet the double masking because we want to depend on the evidence and the information that's received from a scientist. I know that Dr. Brown's team is looking at it as well, so we're going to get all that collated, and we'll be modifying our guidelines if and when we need it necessary. And that means also with people who are dealing with direct contact with patients and close contact with residents, for example, in long-term care facilities, et cetera. So we're looking at those reviews as well, and we'll be coming out with those recommendations and guidelines shortly.
Follow-up?
Yeah, okay. And while I have you, Doctor, a little while ago, you told me that we would need to see less than 1,000 new cases a day before we could move out of the current lockdown. Is that number no longer applicable? Is this new variant so dangerous, for lack of a better word, that we're going to have to continue this lockdown even if we have numbers below 1,000?
You know, that's a good question, Randy, because that was based on the average or the rate of hospitalization and ICU admission, and that was on the regular COVID-19 strain. We're getting some new data in from the UK and others that have a lot of it right now, trying to understand, is that hospitalization rate higher and is the ICU rate higher? And it seems to be indicating that, as well as some of the morbidity and mortality data that is coming in. Because initially they said, well, what it's transmitted better or quicker, they didn't think the mortality and morbidity was higher. Now they're changing that with new data and information coming out because those are more lagging, as Dr. Brown speaks of data points in there. So we're going to have to take that into account and see if the actual admission rate with the variant, if it becomes our dominant strain, as Dr. Brown was alluding to, that would certainly change the pressure on our intensive care units. And that's one of the main aspects that Minister Elliott and the Cabinet has been putting forward to get these numbers down, to take the pressure off our hospital workers who are pushed to the limit right now, and to get that ICU number down well below 200 if we can. But that's going to take concerted effort, and we're going to have to understand how is the variant going to impact us in Ontario. Are our measures holding at the moment? Yes. Do we want to keep it that way? And I know the Premier's just announced further steps around the borders. We're going to do our best to keep that number down and understand how that's going to affect our public and the admission rates as well as ICU rates, and then we'll have to modify our numbers accordingly.
Next question.
From Sean Jeffers at the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, everyone. This might be a question for both the Premier and Dr. Williams. I think a lot of parents are looking at the news over the last day or so, the modeling and the concern about the variant. And they're wondering what this means for the remainder of schools that are closed for in-person learning. You know, I'm wondering if you can talk about your decision-making process here. What are you thinking in terms of reopening those schools, and what does the new variant add to the mix here? I mean, do you think they're going to reopen before February 10th, or will they continue to be closed after that date?
So, Sean, I'll tell you what I'm hearing from parents, then I'll pass the technical side over to Dr. Williams. You know, to the parents out there, you know, I hear you loud and clear. They're stressed. The ones that are still going to work, they go to work all day. They come home, they play the teacher because then they're doing the homework, and then they have the chores, the house chores, and everything else. They're stressed to the max right now, and the kids. It's about mental health as well. I'm hearing more and more from parents saying, "Hey, we got to get the kids back into in-class teaching," and I agree. Nothing is better than in-class, because a lot of kids, and I'm hearing this from the parents, are, you know, they have struggles sometimes, and other ones take to it like duck to a water. But again, our goal ultimately is to get the kids learning back into the classroom prior to you know, the Christmas break. That was the safest place for the kids. We're in the classroom. So that's our ultimate goal, and I'll pass it over to Dr. Williams.
So one of our main concerns, even prior to having the variants coming our way, is the high levels of community transmission. And we've been planning and trying to work at how to first make it available, make it easy, make it effective and efficient to have more screening of the children coming into the school system as we returned after the Christmas holiday season. We waited for that first week of January, and the numbers were even higher than we had hoped for. They're quite high, with high testing rates, etc. And the positivity rates of children being tested in those centers had gone from the low percents up to 12, 13%. So that was very concerning, so we delayed some. Our plan is to have the antigen testing made available, different formats. Where our centers are not so busy in some areas, they could still go for the testing. So to have children with the so-called posse symptomatic or the mild symptom that are coming back in, we want to be able to test those in a very easy way. We worked hard to get the permission to move the antigen test from a nasopharyngeal swab to a lower nasal swab, because children, after they had an NP swab once or twice, even adults, sometimes they're not too thrilled to have it again, and we do want their cooperation. And then also can we get people besides regulated health professionals to perform those tests, and we got that regulation changed as well. So there's a number of steps to get done, as well as getting the kits out to everybody. We're going to have to put that in place so that each medical officer of health, their school nursing program, and the staff they need to undertake those tests to make sure that the parents are saying, because we know with the variant sometimes it's asymptomatic or posse symptomatic, very mild, and the children don't need to carry as much to be spreaders at this time. So we're still trying to understand why that doesn't lead to a lot of infections in the school. They can bring it home and pass it on to the family. So we're going to be looking at how to make it more readily available, because the parents want to know sometimes, could you just check my child out, and is it going to be easy? Can I get an answer back quickly with the antigen test? We can get it back in an hour or two. And a positive test, then you'd have to go to a center to get assessed, because then if that gets assessed with a PCR, then we're going to test all those, as the Premier and the Minister said, with our special PCR we've developed at the laboratory to do the 501 mutation that identifies one of the variants within a few hours, so we can track that very quickly, because we want to assure the parents. They'll say, can you tell us that things are okay in the school? We want to assure the teachers and the staff, is it okay in the school? So this screening is going to have to be done on a regular basis, and that's why we have freed up, and that's why the Minister and the Premier have been working hard at getting lots of the pan bio and the antigen tests there. So we're going to utilize those as best we can to make sure the schools, when they open, stay open, are safe as we did before, but we want this extra amount of screening being done to assess and make sure we're not missing anything, especially if the variants are out and around. And so that's being rolled out, and we're having those discussions with the last number of weeks and continuing with the health units that are open and the ones that are going to be opening in the near future, because our medical officer of health, our table, myself, we all want the children back at school, essential for mental health, physical health, development, and learning. So we're working hard at that, and we know we can do that, and working with the Minister of Education and the Minister of Education to make sure it happens.
Follow-up?
So, Dr. Williams, if I can just clarify that, I think what I understand you to be saying here is that the key to opening the schools in all of the remaining health units where they are currently closed is getting these rapid tests into the schools so that you can do assessments very quickly and turn that around. I'm wondering if that is the case, when those rapid tests will be in the schools, and will it be on or before February the 10th, or is that going to take longer?
We would like to have it prepared for the 10th. We don't know if that will be the day yet for sure. And the tests, whether done in the school or around the school, because sometimes you want the testing done at a central location. We're looking at where it might be convenient for the parent to bring the child to have the testing done. We're also interested because a lot of our cases we saw throughout the fall, even just before Christmas, they were not picked up in the school. The children brought it into the school. And so we're interested too, and I think some families would like to know, can we get the other children tested in the family? Can the parents be tested? Because they would like to know, and then if it is, they would take steps as soon as possible. So we want to make sure that areas that can and need the testing done, because we said before when we did this with the mild symptoms, we had huge lineups of parents waiting for hours to get in. We switched to booking appointments, then they had a long time to get an appointment, and we overloaded our system. Now with equipment and testing available, we want it to be done quickly, conveniently, and easily accessible for some who don't have a car to drive to an assessment center, can be in a location near and around your school centers, so you can do it in a timely fashion and convenient, because you may have to have sometimes 2 tests within 24 hours or 48 hours.
Next question.
From Lorenda Redekop at CBC News. Please go ahead.
Hi, Lorenda.
Hi there. Premier, your government announced back on November 24th that rapid testing was going to be a game changer, but we know that many of those tests haven't been used yet. And I'm thinking of these families of people in long-term care homes where they've had huge outbreaks and tragedies since November 24th. Why did this take so long to implement?
Well, Lorenda, again, I think every time you ask me, I'm going to have to say this, I respectfully disagree. We're getting it out in the field immediately, focusing on long-term care, making sure, and as my 2 ministers will tell you, no one has been on long-term care about getting these tests out there, monitoring them more than I have. It's literally every day I'm on to them. Not only that, within that time period that you mentioned, we've contacted, I think it's 32 companies or 32 sectors to get them distributed all throughout the sectors, and already the automotive sector and a few other sectors are already getting them. On top of that, we had a challenge with Abbott in getting enough supply there, and I made a phone call to the president of Abbott and you know, had a good chat with him, and all of a sudden now we have millions. You just have to put that little extra effort in and call these folks and really put pressure on them, and that's exactly what I did. And from having a couple million tests, we're now up to, I guess the Minister of Health, I think it was 12 million if I'm not mistaken, and we're waiting for more of those to come in. So we're working diligently, and we're working hard to make sure that we get all those pan-bio tests spread out in all different sectors: healthcare, long-term care, schooling, and industry as a whole.
Follow-up?
And this one on vaccines, the federal government announced that Moderna will be delaying some of its shipments to Canada this month. We know, of course, that Pfizer has already cut back its vaccine deliveries. What does today's news mean for the vaccination rollout plan, and will government be able to meet that deadline of vaccinating people in all vulnerable settings by February 5th?
Yeah, well, before I pass to the Solicitor General on the rollout, it is concerning. Now we have Pfizer, and now we have Moderna. We were expecting, I believe, 230,000 doses, so now we're getting 50,000 short for the whole country. That's why I'm asking and I'm pleading and begging Health Canada, please get AstraZeneca approved. I hear the EU just approved it, UK approved it. We need additional vaccines along with J&J, Johnson & Johnson, the Jensen variant. But this all goes back, if there was ever a lesson learned, we have a massive pharma industry here in Toronto, in Ontario, and I've got to make sure this never happens again. We have the brightest people anywhere in the world. We have the equipment, we have the capabilities, so we need to make sure that moving forward, God forbid, and this ever happens again, and let's all pray it never happens again, that we don't have to rely on foreign countries for vaccines. We saw how quickly we ramped up on the PPEs. The other area is syringes as well, making sure that we can manufacture the syringes. I think ATS, I believe, and Manitoba makes them, but why can't we make them here in Ontario? That's something that the government would be more than happy to invest with the company, because there's a worldwide shortage on some of the syringes. But I'll pass the other question over to the Solicitor General.
Thank you. Listen, when we hear the disturbing news from the federal government of decreases in the supply and when they are arriving, yes, it concerns us. But I can assure you, earlier today, General Hillier, Minister Elliott, and I had a meeting with all of the heads of the local public health units. And we have very engaged partners who are telling us and working with us to make sure that the most vulnerable in our long-term care residents and our high-risk retirement home residents are getting those first and second doses of vaccines. The partnerships that are being forged as a result of working together on the vaccine rollout are something that I firmly believe will help us down the road to continue having a high-class vaccination rollout, as well as a very robust healthcare system. I can't say enough for the public health units and the leaders within them who are working with us when we have to move supplies around to make sure that all long-term care residents and high-risk retirement home residents are getting those doses is really heartwarming. So we're making it work. Would we love to have more vaccines tomorrow? Absolutely. But we're working with what we have, and we have willing partners who are making it happen on the ground. Thank you.
Last question.
From Jordan Rivers at Kenora Online. Please go ahead.
Hi, Premier.
Hi.
Knowing that the economy in northwestern Ontario relies heavily on our neighbors from Manitoba, and with the major challenges we've seen in the rollout of the vaccine program, what message would you have for businesses in northwestern Ontario who are concerned about the upcoming summer and tourist season?
Well, as long as we follow all the protocols and we get these vaccines and our mass vaccination program through April, May, and June, that we're focusing, as again, I want to emphasize, as long as we get the vaccines, doing 160,000 vaccinations every single day. And anyone who wants a vaccination, I'd say by the middle of July, should be able to have a vaccination. Again, God willing, we get these vaccines in here. And I just ask everyone, please hang in there. We're doing everything we can to get the economy up and going. I got to thank Dr. Williams too. He's worked very, very hard. He's in a tough position, always balancing health, making health. That's his priority, and trying to balance the economy a little bit as well. It's challenging, but let's all pray we get these vaccines, we get it out there, and then let's look at the numbers. I'm confident if we get everyone vaccinated, we'll see the numbers drop and we can get back to normal. But I'm sorry, I just can't give you a prediction, 3 months down the road. That this is so fluid. We've seen it before. Remember when we were down to 100 and everyone thought, yeah, way to go, let's get out there, and all of a sudden, wham, it hit us in the backside, and it came back to bite us in the butt there. So we'll make sure that that doesn't happen again, and just want these vaccines as quickly as possible.
Follow up?
Earlier in the press conference, you mentioned healthcare workers crossing from Quebec into Ottawa,
Yes.
and you mentioned testing them. I'm wondering if the province is looking at a way to curb interprovincial travel or testing at the interprovincial land borders for COVID-19.
Yeah, that's a great question. I know there's an issue up in Kenora, and I know Minister Rickford mentioned it today on Cabinet, and I had to pull him off the ceiling because what I understand, my good friend Premier Pallister is saying it's okay, but you got to follow the protocols in Ontario. Folks in Manitoba and Quebec, I love you guys, but please don't visit Ontario right now. And likewise to the people of Ontario, don't go visit Manitoba, don't go to Quebec. I understand we have essential workers coming across, especially on the Quebec side, and they'll be tested. But guys, let's all stay at home, stay in your locations, and then we can all have party, and have Manitoba and Quebec and have a real shindig after this is over and we get through this. But for the sake of Manitobans and Quebecers and Ontarians, let's just all stay separate for now. And so I'm asking again to people in Manitoba. Lake of the Woods is a beautiful place, and folks, if you haven't been there, when we get through this, go up to Kenora. It's like God's country up there. But the folks from Manitoba, please don't come to Ontario right now. That's my message. You're great folks, but please hold off.
Thanks, everyone.
Thank you, everyone. Have a great weekend. God bless. Stay home, stay safe, and save lives. Thank you.